that has been a little bit encouraging, I should say, the vaccine news that we've gotten really over the past couple of weeks. But when you take a look at those numbers that you just went through here, the number of coronavirus numbers seem to be going from bad to worse. We have the U.S. setting a record number of new cases, of hospitalizations, and a record number of deaths this week. So for more on this, we also want to bring in Dr. Richard Carmona. He's the 17th Surgeon General of the United States, appointed by President George W. Bush. And Dr. Carmona, great to have you on the program. Thanks so much for taking the time to join us today. We got that good news on the vaccine front, but the numbers are where I want to start with you. When we see more than 240,000 new cases in a single day, a record number of hospitalizations, it seems like at this point, day in and day out, Christmas, we look ahead, is just next week. What do we need to do to curb the spread at this point, especially ahead of the holiday season?
Well, thanks for the opportunity to be with you, first of all. And what we have to do is what we've been preaching all along, is to practice good public health practices. That is, stay socially distant, wear a mask at all times, and stay home as much as you can. If you don't have to be out, if you don't have to travel, stay home. At home, stay within your own family bubble. Don't extend out any further, because you never know who you might be exposing the virus to.
Hey, Evangeline here. So I know that one of the things that has come up that's very important in addressing, the health concerns and the messaging that's going out to individuals, especially to continue masking and continue distancing, even though we know the vaccine is on the way. I got a chance to talk to the current Surgeon General, Dr. Jerome Adams, just about that, and specifically focusing on the minority community. And this is what he had to say.
And that's why I keep saying it's okay to have questions, because there are some real harms that have been done to people of color in the past in the name of science by the government, by medical officials. The Tuskegee experiment, Henrietta Lacks, who got her cells taken without her permission. And so people rightly have some distrust based on what's happened historically.
So as you can hear, and this is something that I feel, the current administration has had to focus on, as we saw the health disparities as well as the disproportionate impact of the virus hit these communities. What are your thoughts on the messaging, and what really is necessary? Has it been this much of a focus in the past?
Well, I think what's good is that we have evidence now that, once again, people of color, communities of color, are disproportionately affected by this virus. That's no surprise, because we understand the concept of the social determinants of health, which place African American, Hispanic Americans, and others at a lower, higher risk rate, and are challenged more by this virus. What has to happen is we need clear, consistent communication, and we haven't had that. It's unfortunate that our nation is divided now, and this issue has become political. When somebody wears a mask, it's more a political statement than it is a statement of adhering to good public health practices. We need people like Dr. Adams, like myself as a Hispanic, others who can represent their communities, who can speak with integrity to the science of an issue. The politics, in some cases, is as deadly as the virus now, because we remain a nation divided, and we have a common foe, this invisible threat, this COVID virus, and we need to come together as one. To do that, we need clear, consistent messaging from the highest levels of government. And then at the state level, we have to apply those public health practices based on the disease prevalence and incidence within our communities. But it's all got to start from the top. We need leadership speaking one message. We need to be able to distance ourselves from conspiracy theorists and those who don't believe in vaccines. The science is clear. Vaccination is one of the, if not the most specifically important advancement in science in the history of our world. Think about polio. Think about all the diseases we don't see anymore. It's because of vaccination. So I can tell you, and as I've told the public, I will vaccinate as soon as my term comes up. My family will vaccinate as well. My friends will vaccinate as well, because we know it is the best way to stop the transmissibility of disease and to accelerate what we call herd immunity, that more and more people then are immune, and the virus then becomes dormant.
Dr. Carmona, going back to what you said a little bit earlier, the fact that we need unity right now, it shouldn't be a political issue. This pandemic should not be politicized. Are you confident that the incoming Biden administration is going to be able to bridge that gap and appropriately address the issues at hand?
I have great confidence. I met the vice president. I know him, and the president-elect, I should say, and the vice president coming in. And I know many of the people that he's putting into office. And of course, I know with the guidance of my colleagues at the National Institutes of Health, Dr. Fauci, our CDC professionals, we have the best science available to us. And I think the president-elect has already said, he understands that sometimes we may have to give him and his team inconvenient truths, but it's our job to be able to speak truth to power on any issue. It is the elected official that makes the policy. But when you try and change the narrative, when you embed our very scientific organizations with politicians who are trying to change the scientific narrative, that is to the detriment of the health of our nation. We must ensure that all of our scientists are free to speak the truth as they see the science, to allow our policymakers, our elected officials, the opportunity then to make the best decisions. And make no mistake, those are tough decisions to make. And this information is sometimes, but nevertheless, the public has the right to know the truth on any issue, including COVID, including wearing a mask, social distancing, the value of vaccines, all of those extremely important today to gain the confidence of the American public so we can get rid of this virus as quickly as possible.
Dr. Carmona, we really appreciate you taking the time. We wish we had more time with you. We hope to have you back once again soon. Thanks so much for joining us today.
Very much.